Alright, so we're going to talk about antifungal agents, antiprotozoas for this PowerPoint. This will be a pretty short one. We'll include antibiotics in the next one. That's pretty extensive. So antifungal agents. Systemic azole antifungals. This is fluconazole, ketoconazole, terbinafine. When we're taking these systemically, there's some things we need to be careful with. The way these work, they're fungistatic and fungicidal, so they stop reproduction and they kill the fungus. And our indication is treatment of fungal infections, candidiasis, onychomycosis, histoplasmosis. There's all kinds of them that we use these for as far as funguses. Adverse effects. Anytime you think of systemic antifungal medicine, think hepatotoxicity. If it is a systemic antifungal medicine, hepatotoxicity, it's always right there. Also can cause some bone marrow suppression. So it would be contraindicated, of course, in hepatic disease. It's contraindicated in pregnancy. Be careful in people with history of hepatic or renal impairment. Interacts with alcohol. Again, watch out for that liver. Interacts with digoxin, warfarin. Patient teaching. Take doses as prescribed. May need blood tests for monitoring. Again, do not use alcohol. Amphotericin B. This is when we're getting serious about these infections. When someone has a very serious fungal infection. These are serious medications. I wonder if I've said serious enough. Anyways, they change the permeability in the fungal cell wall, so that's not bacterial, but fungicidal, so it kills the fungus. And again, the indication: severe, potentially fatal infections. Aspergillus, Cryptococcus. These are for systemic, serious infections. Adverse effects. Nephrotoxicity. Remember, we talked about hepatotoxicity for any sort of systemic antifungal medication. Bone marrow suppression, hypokalemia. And then these can also cause an infusion reaction 1 to 3 hours after initiation. What that means for us is we need to make sure we're administering these slowly. Contraindications, renal disease, liver impairment. We'll be really careful in people with electrolyte imbalances. And they can interact with aminoglycosides. Patient teaching. Well, these are given in the hospital. So a lot of this is nursing intervention. The main thing being that needs to infuse slowly, no less than 2 hours. According to the NIH, they can't be given in less than 2 hours. They usually are 2 to 6 hours, depending on the dosage. And we've got to make sure we're monitoring kidney function and INO. We also have to monitor for the potential for infusion reaction. Those symptoms are fever, shaking, chills, hypotension, nausea, vomiting, anorexia, and increased breathing. They're more common after about 1 to 3 hours after starting the infusion, so that's why we start them slow and we go slow, because that's it takes about 1 to 3 hours before you start seeing this reaction. So we're going to monitor for that. And then, of course, when they go home, they're not going to go home on amphotericin B. They'll go home on something else, so we'll kind of prepare them for that. Topical antifungals, very common. A lot of these you can get over the counter. A lot of times they prevent replication and they also kill the cell, so they're both fungicidal and fungistatic. Our indications, gosh, we use them for all kinds of things. Ringworm, candidiasis, tinea. Tinea is a ringworm. Infections of basically any infection of the skin or mucous membrane. Adverse effects. Really, it depends on the type that you're using. If you're using a topical cream, lotion, usually there's not many adverse effects. Maybe a little bit of redness. Some people um, may report some burning or a rash. Every once in a while, maybe some swelling. However, sometimes the topicals can be taken by suppository. If you think about a yeast infection, we use suppository sometimes for that. These people may have a little more systemic type of adverse reactions like nausea and vomiting, and then discomfort at the area of administration. But realistically, topical antifungals are um, pretty well tolerated. As far as patient teaching, there are some things we need to consider. Um, we want to complete the full course of therapy. So don't stop just because it looks like it's getting better. Take exactly as the doctor prescribed. Avoid open wounds, and then don't cover with occlusive bandages if you can help it. Just be careful of those things. Antiprotozoal agents. Metronidazole, this is one of the most common antiprotozoal medications you're going to see. It's also called Flagyl. You may have heard of it. We use it, it's an antibiotic as well, so it's not just for protozoas, but that is what we use it for, treatment of protozoal infections, but also, again, anaerobic bacterial infections like C. diff, pelvic inflammatory disease, H. pylori. And again, its action is it's bactericidal. Um, so it kills the bacteria, also inhibits DNA synthesis. So that's how it works. Adverse reactions, uh, GI distress, because it's pretty broad spectrum. Um, it can also cause darkening of the urine. This one can cause some CNS symptoms as well, ataxia, even seizures. Numbness of the extremities, that's one of the more common CNS symptoms. This is a disulfiram effect medication. When you go to your antibiotic PowerPoint, you'll learn a lot about that with some medications. A disulfiram effect means you can't drink alcohol while you're on it. You can't drink alcohol while you're on it or 72 hours after you stop taking it. So we need to make sure we're teaching people about that, because it can cause some severe nausea, vomiting, headache, weakness. Um, it can get pretty serious. It's usually, most people um, call it like a bad hangover. They just feel like they had a bad hangover, but it can get serious. So we'll make sure they understand, do not drink alcohol while you're on this. Be careful as far as cautions go. CNS disorders, if they have any CNS disorder already, because we can have some of that problem, or interference there. Be careful with hepatic impairment because it can potentially cause some liver problems. Interacts again with alcohol. We know that. We just talked about it. Or interacts with warfarin. It will increase the bleeding, so we'll need to watch INR closer, and they may have to have adjustments in their dosages. Patient teaching. Take all prescribed doses. Do not drink alcohol while taking. Anti-helminths. Oh, helminths is everyone's favorite discussion. Who doesn't love worms? They're just the coolest. So again, they're worms. That's what helminths are. The most common site of infection, of course, is the intestine. Though they certainly can get other places. They absolutely can. You'll see reports of them in eyes and brains and muscles. They can get serious. They absolutely can. Usually, it's limited to the intestines, so it's not too bad. Most commonly diagnosed via stool examination. Transmitted through contaminated food. Of course, carrier insects. Mosquitoes can carry this. Other things can. Penetration of the skin. You're walking around barefoot. I know a lot of people like to do it in the summer. You're just putting yourself at risk for worms. Those little hookworms will get in there, get into your bloodstream, because they'll go in through your foot or your skin, just wherever you happen to come in contact. Maybe playing in a sandbox that's infected with hookworm. They get into your bloodstream, get into your heart, then into your lungs. You cough them up and swallow them, and then they grow. Isn't that exciting? It's just so fun to think about. I hope you're eating. Oh, please tell me you're eating. That would be fantastic. Uh, Goals of treatment. Okay, so obviously to kill them, right? To get rid of them, but we got to think beyond that because just killing them is not enough. You have to also prevent spread. You have to teach people to take a lot of precautions to make sure that because they can get rid of them. We can get rid of them very easily. One to three doses. I mean, it's really easy. As long as they're intestinal, they're really easy to get rid of. The problem is other things can be contaminated because of just the way these things work. You can reinfect yourself. So prevention of reinfection or spread. Adverse effects, GI distress, because again, it's all mostly intestinal. Some people complain of some drowsiness or dizziness or headache. They're fairly well tolerated though. Patient teaching. Take as directed. Again, usually 1 to 3 days. May take with meals. Wash hands before eating and after using the restroom. Take daily showers, not baths. Think about that because these things come out. They're intestinal. A lot of times they come out through the rectum, and you just lay there with their eggs and everything floating around, and you won't know. It's not like, these things are fairly microscopic as far as the eggs and such. You wouldn't know. You're just recontaminating yourself. So again, no baths, only showers. Wash linens in hot water and wash them every day. Wash sheets, towels, underwear, everything daily. I know that's kind of tough for some people. Some people like to do the 4-day method. You wear the underwear and then you turn them backwards and you flip them inside out and you put them on right and then you turn them backwards. Get 4 days out of a good pair of underwear. But it's really not good practices just in general, especially if you have worms. So let's go over that one more time because this is really important. Take as directed. It's really pretty easy. It's only 3 days usually is the most. A lot of people can do them in 1 or 2 days. Take with meals. And then we've got to worry about reinfection. So washing hands before they eat or and after using the restroom. Take showers, not baths. Wash linens and towels and underwear every day in hot water. Hot water. And that's it.